There are many factors in our lifestyle that can have an effect on fertility. One of the most important ones is age, and fertility can decrease significantly as a woman ages. Her relative fertility can decrease by half between the ages of 30 and 37. This is because when a baby girl is born, all the eggs that she's ever going to have are there already in her ovaries, and they're lost regularly throughout life up until the age of menopause. This means that as someone gets older, it's harder to get pregnant, and there's a much greater risk of miscarriage and chromosomal abnormalities as a woman approaches 40. Ovarian reserve, or the number of eggs remaining in someone's ovaries, can be tested by the egg timer test. This is done by a blood test and an ultrasound scan. It can be really useful to have an ovarian reserve assessment, because then someone can make their lifestyle decisions from there and see whether it's the right time for them to start a family. It's important to maintain a healthy lifestyle when you're trying to get pregnant. Diet, weight and exercise are all things that we can consider. For diet, it's important to have a healthy, balanced diet with lots of green leafy vegetables. If anyone is significantly overweight or underweight, they can both have adverse effects on fertility, and that goes for males as well as females. Exercise should be maintained on a regular basis, but not excessive. So exercise greater than 4 hours a day can also have adverse effects on fertility. Other lifestyle factors that need to be considered are coffee, smoking and alcohol. If you're trying to get pregnant, it would be recommended that you keep your coffee intake down to less than 2 cups a day. If you're female and trying to get pregnant, no alcohol would be recommended at all. If you're male, then maybe 1 to 2 glasses a day. Smoking can have a major impact on fertility, both for males and for females, and it would be strongly recommended that you speak to your doctor on ideas about helping you stop. One of the most common preventable forms of infertility is tubal infertility, and one of the greatest causes of that is from chlamydia or pelvic inflammatory disease. It would be strongly recommended for anyone who's not in a monogamous relationship to use condoms at all times in order to prevent sexually transmitted infections. Maintaining a healthy lifestyle with activities that optimise well-being has been proven to improve your chances of pregnancy.